Good morning, everybody. I'm Jennifer Oberenda, Project Coordinator for ARISE UAE. I will be your moderator this morning. Welcome to the official press conference to mark the launch of the Middle East's first ever global online COVID-19 rehabilitation program in collaboration with RAK Hospital. ARISE UAE is an initiative in the United Nations Office for Disaster Risk Reduction, UNDRR, and is the first private sector alliance for disaster resilient societies in the Arab region. In this press conference, our speakers will be introducing the online COVID-19 rehabilitation program, its features, details about the program, and who can benefit amongst other things. Please feel free to type in your questions using the chat box, and these will be answered at the end of the session in the Q&A round. As I understand today, there's a cross-section of media present. So Mr. Rami Jamal is present to translate to Arabic if need be. I'd like to now introduce our speakers for this session. First, Dr. Mahmoud Al-Barai, Chairman of ARISE UAE and Vice President of the International Real Estate Federation and Senior Advisor in Dubai Government. Next, Dr. Tariq Ahmed Nizami, Vice Chairman of ARISE UAE and founder of Club Network Worldwide. Next, Dr. Raza Siddiqui, ARISE UAE Board Member, RAK Hospital Executive Director, and CEO of Arabian Healthcare Group. And finally, Professor Adrian Kennedy, Chief Wellness Officer of Arabian Wellness and Lifestyle Management at RAK Hospital's Wellness Division. I'd like to now invite Dr. Mahmoud to start the session. Thank you very much.
Thank you so much, Jennifer. Thank you, everyone, for honoring us today. Actually, this is a historical day. Today, we launch a very important strategic initiative between ARISE Network of the UAE and RAK Hospital. So ARISE Network of the UAE, from day one, when we were established in September 2020, the aim was at that time is we wanted to be part of business continuity strategies, how we make businesses in the UAE weather the crisis, weather the COVID-19 challenge and become stronger. But as we invested in the resources and research, we came up with this great idea, which is we should be also part of making communities more resilient, how we make communities more resilient by investing in their health. So today's initiative is an important one with the RAK Hospital. It aims at dealing with people with long-term symptoms of COVID. So the recovery stage, COVID was not that easy, and it's a challenge, and it's still a challenge. 2.65 million people, I think, so far died of this. 100 million got this COVID. So it's a challenge. And it's not only health challenge, it's also challenged the economy, it challenged the social life, and it makes things more difficult. We're lucky here to be in the United Arab Emirates, where the leadership has taken a lot of great initiatives to make us safe and healthy. And recently, even His Highness Sheikh Mohammed bin Rashid Al Maktoum announced the master plan of Dubai for 2040. And if we look at this master plan, it tells us the shift in thinking. Now we're thinking about how we make our cities healthier, how we make them more resilient, more sustainable. So we as a RISE network represent the private sector voice. We will work hand in hand and side by side with the government of the UAE, government of Dubai, and the private sector. And the focus will be on how to make sure that we have a resilient community in the UAE, resilient businesses that can work with all the kind of challenges, how we weather all kind of risk that we will face. So I would like to thank RAK Hospital. I would like to thank Dr. Raza Siddiqui and Professor Kennedy for the great work, taking the leadership in making sure that we have this program. And this is actually the first in the Middle East, if not globally. Recently, the United States allocated $1.1 billion just to study the impact of COVID on people's health long term. The United Kingdom has invested £25 million. So this is not an easy thing. And this is why we're taking the lead as UAE here, and we're taking the lead in terms of studying the impact of COVID on people's health and supporting them, not only medically, but also psychologically, nutrition-wise, and all the different aspects. the program. So I would like to stop here and give the floor to Dr. Tariq Nizami. Thank you.
Thank you very much. First, I'd like to thank, on behalf of ARISE UAE, all the media for attending today's press conference. As our chairman says, that today is an ARISE UAE's very specially important day, as we are launching our first initiative, the free comprehensive online COVID rehabilitation program in UAE, in collaboration with the RAK Hospital, which is highly respected health provider in UAE for decades. As you know, the need to create risk-resilient societies and inevitable in today's environment, and by forming the first national ARISE in September last year, we have shown that UAE is a leading private sector engagement for disaster risk reduction. ARISE UAE aims to achieve the outcome and goals of the Sendai framework in transparent and inclusive way, delivers the measurable impact and set the roadmap for all the other Arab countries. COVID-19 has put a stark reminder to all of us that reducing risk of disaster, whether natural, man-made, or biological, has to be everyone's business. ARISE UAE would like to thank RAK Hospital for choosing our platform for this great initiative, which is highly needed in this current COVID-19 crisis, which we hope and pray is over soon. We all go back to our normal daily routine in our business, in our family life. So I'd like to thank again the RAK Hospital. I'd like to thank the media again. Over to you, Jennifer.
Thank you. I'd like to now invite Dr. Raza to speak.
Good morning, everybody. Thank you very much, Jennifer. Thank you very much, Dr. Mahmood, Dr. Tariq. I take this opportunity to welcome the fellow board members of UNDRR ARISE UAE, members of the press and RAK Hospital team. Thank you very much for working hard and producing this wonderful product within a month's time. COVID-19 has been one of the biggest disasters and challenges the present generation has ever experienced. As Dr. Mahmood said, more than 119 million people have suffered up to now. 2.6 million people, unfortunately, have lost their precious lives, which is around 2.2% of the people have lost their lives. This is all sad news, but good news is that more than 95 million people have recovered. But these people who have recovered have not recovered fully. Most of them have recovered medically. But if we see their psychological state, their physical state, their nutrition state, they have a long way to go. The background, the initiative of the development of this program came from my core team member. She was admitted, unfortunately, she was seriously sick with this disease, and she was in ICU for more than 2 weeks. At one stage, we almost lost her. But Alhamdulillah, with the advent of newer techniques and new medications, she recovered well. And she is the person who initiated this rehabilitation program. She came to me personally and said, "Boss, I have recovered, but I have not recovered fully. And I'm trying to gather information from different sources. I am in a hospital environment, but even then I have to go to 20 sources to find ways to recover fully." And she is the one who initiated, we worked together, developed a program. And with the help of Professor Kennedy, we launched first in the hospital, then launched a real physical program for the people of UAE. The success was tremendous, and we saw a large number of people getting benefited. That is when I spoke to Dr. Mahmood, and the board members of UNDRR ARISE UAE kindly approved the program, and Professor Kennedy and his team developed this program within a record period of almost 4 to 6 weeks. It is my pleasure to present the program in front of you. This program takes on from the time a patient recovers. We have a team which is going to support the online program. We'll have a team of physicians, team of nutritionists, team of physical rehabilitation specialists, team of yoga specialists, and we will try and customize maximum solutions and help people in recovering faster and coming back meaningfully, powerfully, bounce back into their normal day-to-day routine. Professor Kennedy, now the floor is yours. You are requested to kindly give the live demo of the recovery program, please.
Thank you, sir. Thank you, Dr. Raza. Friends, are you able to see the full screen? Yes? Good.
Yes.
So I will go ahead. My esteemed colleagues who have spoken before me have mentioned that COVID is a long ailment. It's a long-term ailment, and that's absolutely true. Now, as a consequence, a natural result would be to create a program that could support recovery from this ailment. And with that, around the world, we sprouted up with several physical programs. It sprouted up around the world, and RAK Hospital was one of the institutions that did that also. The idea then came along from, as far as we were concerned, from Dr. Raza, but the idea sprung up in several other parts of the world, which says that why don't we use the technology of the computer and try and create some sort of online reach. And then the UK, the NHS, created what was known as the COVID rehab counseling system. That was where we stood till Dr. Raza suggested that we need to go into a full-time COVID rehab online program, which doesn't only require counseling, but gives you a complete prescription. What we've done over here and what I'm presenting to you is not just a scan, but also a portal that will continue to give us information on a day-to-day and week-to-week basis for those of our colleagues who are unfortunate to have been stricken with COVID-19. So now you're looking at the screen, and right at the top on the left-hand corner of the screen, you will see the RAK Hospital and the ARISE logo. ARISE logos, if you were to click to these logos, you would be taken to these esteemed organization sites. And the reason why these remain there is because it will give some credibility to the product that we are showing you. Now, about this product. Right in the beginning, if you were to click on About, you will find that there is a brief explanation about the RAK Hospital and UNDRR ARISE UAE post-COVID recovery and rehab program, which is an online program and complimentary, which obviously means that there is no charge to this. So this is a brief explanation about the program per se, just an introduction. Now let's talk in terms of the health resources. Again, to show you where we come from. I'd like to go to health information just to show you that the basis of this program is with the WHO. The WHO created and has created the same as CDC has created and NHS has created a lot of information on rehab. So I thought that we would capture some of the broad information that we have over here that will explain what our product is. So if you were to click on either of these view sites, you would see the program. But since it seems to be taking a little time, we will move on to the next part. Now, you have our health tips. Now, these health tips will come out once every week. And once a week, you will find that this information is provided to the individuals who have long-term COVID, and they will be advised how to do their exercise, how to manage their diet, how to improve their immunity, how to improve their posture, why they should avoid smoking, and so on and so forth. At the end of the year, you would have 50 to 100 such tips, which would be very, very valuable information. We also have a webinar. Now, this webinar is also conducted once or twice a week. In this webinar, we will have eminent speakers in-house from the RAK Hospital, and also international speakers who will come in, you can hold it there, who will come in and speak on different aspects of the latest research on COVID. So you will talk about the different variants, you will talk about the different forms of vaccination, you will talk about the different philosophies in relation to COVID and so on. And all of this will be saved in our video section, which is within the health resources. So within the health resources, you will have the saving of all the topics that are spoken about during the session. Could we just play the psychologist, for example? Go to the center.
Come once a month. The aim of the initial sessions is also to name your problem. What is it exactly that you are struggling with? Is it something that you have had?
And now we will go directly to the product. The product is simple, it's simple, and sometimes simplicity is clarity. The questionnaire comprises of two broad aspects. It captures all the information that you need to provide to your medical professional in order for us to be able to give you some support. So the questionnaire will first save all your comorbidities. That's the existing ailments that you already have. Blood pressure, diabetes, hypercholesteremia, kidney or renal problems, whatever you have will be captured. And then we will move on to your symptoms. The questionnaire, Dr. Viku. Yeah, the first things first, and that is the medical disclaimer. This tells you, broadly speaking, that this does not replace the medical doctor. It provides you information relevant to your needs. Now, this particular section deals with comorbidities. This is the ailments that you have prior to COVID. So it could be diabetes or heart ailment or lung dysfunction, etc., etc. You just click in your answer and move to the next section. Now, in the next section, it would ask you whether you smoke or drink alcohol, whether you are hospitalized, and if you were hospitalized, were you in the ICU? And if you were in the ICU, etc., what were your symptoms? So we've captured the comorbidities on the one hand, and we've captured various symptoms on the other hand, and we click all these factors and just send it straight to our expert system, which will then create an immediate prescription for you. We now move to the, I can see that we are filling in a few more symptoms. So this is by and large a 20 parameter product, which means it takes all the different variables and then gives you different prescriptions. We now move to the actual prescription. And this prescription comes out in an instant. It identifies the individual, it identifies that he has COVID or she has COVID, gives you the BMI, etc. And straight away for your physician, it lets the physician know the comorbidities of diabetes, hypertension, cardiac ailments, etc. on the one hand, and also identifies the existing ailments. You have ailments during COVID, but you also have ailments post-COVID. By and large, we are interested, as far as rehab is concerned, in the post-COVID rehab symptoms. We capture these symptoms and then we give you a prescription for each of these. Now, first of all, we have the medical advice, and in the comorbidities, we had indicated that this individual has diabetes, or the individual indicated that he has diabetes. And it mentions over here, if you look at the third dot, as you have diabetes, please continue, which means that it takes into consideration that this product takes into consideration all your comorbidities and then gives you a prescription relevant to your specific comorbidity. So it will give you a life change prescription on diet, exercise, stress management, etc., etc., which is not only relevant to COVID, but also relevant to your comorbidity. So you have a multidisciplinary or a multi-ailment prescription that is made available. Yes? And then it gives you your diet. And then you will notice that in your diet itself, it will tell you that since you have diabetes, yes, as you have diabetes in the middle of your screen, as you have diabetes, please consider, and it gives you some advice. So broadly speaking, the entire prescription would give you advice to COVID, which is specific and primary, and would also support it with your comorbidity prescription. Yes, and then of course, because you are ill, we would give you supplements, which is so essential. And then for more information, we would ask you to click, and it takes you to a large volume of information that contains details, further details about diet. So this is what we have. Yes, let's move on to the exercise component. So one is the dietary aspect, and now we look at the exercise aspect. Three broad categories of exercise: stamina, strength, and flexibility. We give you exercises that you can do at home, basic, simple exercises. And this was done by our physiotherapy department. Yes. And you will see that there are several exercises. Go to the middle, Dr. Wilku. Go to several exercises.
Also done jumping.
Yes, side. Yeah.
And from here you have the side splits.
Yes.
Excellent for increasing.
Yes.
Run outside. Will be the first. Increase your chest and increase
just
your
another
lung
minute
capacity.
to complete.
Breathe
yes, move on,
into
Dr. Wilku, please. And then from here, you move on to the stress. I won't show you these videos at this moment, but stress is such an important component. And we've taken this prescription from some of the world's leading authorities in stress, including our own in-house team. Let's move on. And in case you need more information, you need just click at the bottom over there, and it will take you to our own encyclopedia, which contains a lot of relevant information regarding stress, mental health, sleep, and so on. Yes, Dr. Wilku, let's move to the next one. And after we do this, we've covered the three broad areas of lifestyle, which is exercise, diet, and the management of stress and sleep. We now go to these specific symptoms. In this instance, we've indicated fatigue, so you will get you will get some support on fatigue, yes, and advice on memory, brain fog, yes, and then you will get some information on managing breathlessness. You are so breathless sometimes that you cannot even stand. It is frightening to be in this position, especially if you are suffering from the ailment. It is frightening. So we give you a lot of information, and this methods of how to breathe, etc. And then we go on to managing your cough and also managing your sleep. Now, this, broadly speaking, is the questionnaire and the prescription. It is back-ended by a whole lot of webinars that will happen once a week. It is back-ended by the health tips that we give. And this is available not only in the UAE and GCC, but we are hoping that individuals from around the world will take benefit. Thank you very much for this opportunity to present this aspect. Thank you.
Thank you, Dr. Mahmood, Dr. Tariq, Dr. Raza, and Professor Adrian. We're now opening the floor for questions. We have two questions. We have the first one from Sucharita Chowdhury. They would like to know what kind of insurance will support the post-COVID rehab program.
So, can I take this question?
Yes, please.
Of course.
Yeah. Suchitra, thank you very much. This is free for everybody. The whole idea is to pass on the benefit to largest segment of society. This is not only free here, but internationally. So this is a free program.
Okay, thank you very much, Dr. Raza. The next question or comment from Dubai Events: COVID-19 poses a severe threat to all communities, but refugees and people who are displaced and those living in low-income areas will face even greater challenges. I hope this rehabilitation program will, I hope this program will address the issues faced by refugees, displaced peoples in camps and camp-like settings, as well as explore various options that may help to reduce the transmission of COVID-19 in the high-risk individuals in these settings. Please share your thoughts on it. Thank you.
If you want me to start, Dr. Raiza, then I will. I just want to mention something on this because this is a very important topic. We've been discussing with UNHCR on how we can support as ARISE network. Recently, I visited the Zaatari camp in the Syrian camp in Jordan and seen the COVID measures there and the amount of really great work that the United Nations is doing in inspecting and finding out the COVID patients and supporting them and giving them vaccine. But I think this program, again, will be open to them because this is all you need is the access to internet, and this can be accessible to them. Plus, we are actually talking to the UN to do some work on different refugees camp when it comes to COVID-19. One of them actually is the mask production. So I've seen in a Zaatari camp, they have very nice place to do the mask production that actually produced even more than what the camp needed, and actually they transferred most of it to the rest of Jordanian cities. So supporting refugee camps to build internal capacities and resources is an important thing. Dr. Reza, if you want to add something to this?
No, thank you very much. I only wanted to add that this is available as a mobile app. So anybody, these days, everybody has access to a mobile phone. So this is available as a mobile app and everybody has that open free access for this.
All right, thank you very much. We have a question in Arabic. If please, Dr. Jamal, Mr. Jamal can read the question in Arabic. It's in the chat box.
Yeah, hi, good morning, everyone. There is questions here from Mr. Ahmed from Al Bayan newspaper. He's asking here one question. If there is any specialist doctor, it will be only special for this kind of our program, which we are having. This is number one. Number two, this is questions for RAK Hospital, which he's saying here, how many patients get the benefits and the profits from this program since RAK Hospital started? This is kind with the corona.
Okay, thank you very much for this question. Very interesting question and a very good question. As we said that we will try and support maximum medical support to these people, but physically may not be possible. But in terms of webinars, we have identified 3-4 areas where people need help. One of them is cardiology, neurology, and physical rehab. So these specialists will be available as and when required on weekly webinars where question answers, and mainly their webinars will be focused on post-COVID recovery and what are the complications and how to manage them. So 3, 4, 5 specialists will be available to give webinars. That is always available. In terms of numbers, a large number of corporates have participated in COVID rehabilitation program at RAK Hospital. At this moment, number will be difficult, but I can say more than 30-40 companies have participated. Professor Kennedy knows more, but large number of people have benefited, and we have seen their recovery, dramatic recovery and participation.
Rami, I think you need to translate for Mr. Ahmed.
Rami, yeah.
الإجابة من دكتور رازق صديقي هيكون في تخصصات من الدكاترة متعددة في الموضوع، منهم دكتور القلب، المخ والأعصاب، الأمراض التنفسية، وهيكونوا available دايما، هيكونوا متاحين دايما في الإجابة والتعاون والمشاركة عن طريق المريض من خلال البرنامج. عدد الذين استفادوا عدد كبير جدا استفادوا منهم، شافوا هم الملاحظات الموضوع ده وبالتالي اطلقوا المبادره دي.
Thank you very much, everybody. I have another question from Anu Manon. Do you have any study of the demographics most in need or of benefit for this rehabilitation program?
This is too early to have that. And I think after a year or so, we will have some data. But at this stage, it is too early to say and too early to analyze.
All right, thank you very much. I'd like to ask if there is any other questions from the media or the press. I have a question that we could propose. How long does one need for this rehabilitation program? How long would you recommend that someone partakes in this program?
If I may,
yes, please.
As far as long COVID is concerned, the symptoms may persist, may not happen at all. They may persist for a week. They may persist for 3 months, and they have known even to continue for 9 months. That is one aspect. The other aspect is that when it comes to good health is a lifetime effort, which means that the advice that we give you in this particular program, which pertains to diet and exercise and managing sleep and all these other aspects, will benefit you throughout your life, whether or not you have COVID. So my advice to you is the specificity of the program will be relevant to you as long as you have COVID, which could go up to about 9 months at this point of time. That's the information we have. But otherwise, the benefits of this program will last you a lifetime by virtue of the fact that it deals with factors such as diet, exercise, stress, sleep, and so on and so forth.
Can you hear me?
Yes.
This is Sitra again, Dr. Radha. Had a question.
I'm about
yes.
to finish.
Can I ask?
Thank you so much.
Yes, please. Yes.
Okay. So one thing I wanted to know, this whole ARISE movement or ARISE initiative, just one hospital doing all this, when we have so many people, can this program be extended to all other hospitals so that people living in various emirates and people who are not having access to our RAK hospital are able to, avail of this program, and actually a whole lot of people would benefit and a whole lot of people need rehabilitation. So is there any plan to extend this to other hospitals? Thank you.
So it's a very, very interesting question, and thank you very much. And I was expecting this question to come from somebody like you. So thanks. Suchita, this is an online program. So this is open to everybody. In terms of supporting this program, we need larger participation. And there is no question of any competition here because we don't believe in this. There is always opportunity for collaboration and cooperation. So what I propose it and what we will do in future is, in terms of the webinars, we will ask for participation from different hospitals of the region and ask for volunteers who would add value in terms of counseling online and giving talks online and doing webinars. So large number of doctors are most welcome, not only doctors, like for example, we'll be tying up with some yoga institutions to give some online yoga guidance to people who have suffered. So we are open. It has to start somewhere. This is just starting, but we will open to all our fellow hospitals and other like-minded people. Like for example, perhaps I will seek immediate help from our friend Atif from Danube to reach out to large number of people, because awareness is very, very important. So Danube may be the next company to power this program. So we will open it to large number of hospitals, institutions who want to come forward and participate and support the program.
And Dr. Reza, we're in talk actually with Dubai Police, who is leading Dubai Resilience Strategy. We've been working with them very closely in different areas. And actually, this is an area that we're discussing the expansion and reaching, especially the labor camps and disadvantaged people. This is in reference to the question on areas of focus. So we don't work in isolation. We work with the government of UAE, government of Dubai. We work with the different NGOs and international bodies here. We work with businesses. And next initiative will be on business continuity, which is, again, if we have healthy people, healthy individuals living in the country, in the city, then this is going to be also positively impacting productivity of companies. We're very glad that Danube and other companies will take this forward in their organizations.
Thank you so much, because I feel that there are people who may not even have access online to online facilities. There are blue collar workers and there are people who may need this help online. So it will be really great when other companies are able to reach out to them in a different sort of empower them. Thank you.
I think, Sujitra, great idea and great suggestion. And I think because as I said, good things has to start somewhere. This is just starting. And we will ask for larger maximum participation. You are right, we may go to labor camps to do real-time counseling and talk to them, and a lot of things could be done. But thank you very much for this suggestion, and we will start working on phase 2.
Thank you.
Thank you very much. I have a question or a statement from Saman. There are people who are not affected by COVID, but however, by their loved ones, they are. So can this program be availed by people who want to learn more about the disease and maybe learn how to handle it or prepare themselves for the future?
Professor Kennedy?
I'm sorry, I didn't quite catch that question. If you could kindly repeat, Jenny, I'll be grateful.
No
Jenny, can I frame it myself? Hi, sorry, this is Saman. Can I say this myself?
Of course, go ahead, please.
Sorry. So Professor Kennedy, so my question was because COVID is something that we are surrounded by every day. People around us are affected. This program also gives us a lot of insight about how to handle this, how to handle maybe our loved one if he or she is affected by COVID. So can we, as people who are not affected by COVID, can we also enroll into it and maybe get more idea about how to manage the disease? Or is it only for COVID?
Absolutely. Caregivers are individuals who probably have higher levels of stress than the patient themselves. There is absolutely no doubt about that. And therefore, this product deals not only with the individual who has COVID, but we could also attach on the health program that we have, which will give you all the individual advice that you need to manage your own health. I will talk with Dr. Azhar and we would find a correlation between these two products so that we could integrate a specific section for healthcare providers. It can easily be done. That is one aspect, and also through our webinars, you will find a lot of information that will be made available to healthcare providers or to family health providers, etc., to be able to manage these aspects, to manage the dietary aspect, to manage the activities of daily living aspect, to manage the aspects of sleep, to manage the aspects of their personal stress. All of this can easily and will very comfortably be covered by this vision.
I had one more suggestion, Suchitra, here again. The suggestion is that if this program or people who are the go-between can be of multilingual or multicultural backgrounds, where people from different languages can converse with them, because not everybody may be very fluent in English. So they can be people who speak Urdu or Bengali or maybe Sinhalese, all people who know most of the South Asian languages, especially for the blue-collar workers. So then they can be, the webinars could be translated into different languages so that it really is absorbed by the person in his own native language. That could be one way. Thank you.
Very good suggestion, and we will try and implement to maximum. Suchitra, thank you very much.
Suchitra, just for your information, the RAK Hospital deals with about 10,000 blue-collar workers every year. We reach out to at least 10,000 lives, and we manage all these programs in the local language, which means we are talking Hindi, we are talking some of the other Indian languages, we are talking some of our own local languages. So we have some experience in dealing with thousands of blue-collar workers.
Thank you. Thank you.
I think we have one more question. How long will this program be available for?
Initially, we are starting, the plan is for 6 months, but looks like COVID is not going to leave us so soon. So maybe for 1 year, it will be available. Then we will see after 1 year how it goes. Hope and pray that that COVID leaves us for good after some time. But recovery program will take time. So 1 year it will be available. And then we will see and review again.
All right, thank you very much. If we don't have any more questions for now, I would like to close the session. So thank you everyone for attending this press conference. Please do not hesitate to get in touch after at info@ariseuae.org for more information, or if you have any more questions. We wish you all the best and take care. Thank you very much.
Thank you so
Jenny,
much.
Jenny, can we take pictures of all the speakers in one frame before we exit the meeting, because we will need to supply this to the media. So all the speakers in one frame. Yeah.
So if the speakers could please stay behind. Yeah, thank you very much.
Dr. Tariq is missing, I think.
No, Dr. Tariq is still here.
Still here? Okay, now it's good.
I can't leave until you say I have to leave.
Jenny, mainly our 4 speakers, the key speakers today. We can have them in one frame if that's possible.
Yes.
Done, or we have to hold?
Anurupa, how would you like the screenshot? Just in one line is fine, or it has to be no one else in the frame?
Ideally, no one else in the frame. One line, or it could be, like 2 above and 2 down, like that, 2 below. So that,
okay.
the picture is better.
Okay. Thank you very much.
Are we done, Jenny?
Not yet.
You have to give us 2 more minutes, I guess.
Brother Atif, a lot of eyes are on you. You are muted.
Hello. Yes. Good morning, everyone, and Assalamualaikum, everyone. Tell me.
And we have to work together and make it successful.
Yes, definitely. Why not? And we look forward to it, and the great opportunities. And I think the more we try to spread it, the more number of people are going to benefit out of it.
I think a lot of good ideas have come together, and we can together form a team which will reach out to corporates, to communities, and to labor camps as one of the initiatives. And that initiative would be anchored by Danube in many ways. So we can work out some logistics for this. So we will form a pool of speakers and counselors and caregivers who will form the team, and then together we can work.
Yep, look forward. Look forward. I think, reaching out to community, best way is corporate, through the corporate.
Yes, yes, yes.
You have the reach and you have the resource,
Correct, absolutely.
It always makes. By the way, during the press conference, I did send to chairman the logo. I think chairman picked up one of them. He liked one of them. I think you can post it or the UNDRR if you wish.
Yeah. Okay, that's cool.
Yeah. So we have a logo for the COVID rehab.
Are we done with the picture? Or
Okay, if sorry to say, but if Atif could leave and then I will leave, and then Ariane will take the screenshot.
Okay.
That's fine.
No problem.
No, come on, we want Atif. No, just
okay, if you want him in the picture.
No, Atif is part of the team. Atif is part of the team.
Okay, then I'll leave.
That's why I mentioned 3 times his name.
You're
He's
part of the team, Jennifer.
Okay,
Jenny, should I leave then? Maybe you'll get a better.
Yeah, if me and Anurupa can leave. Okay,
yeah,
thank you.
Let me leave then. But give me good pictures. That's what I want.
Okay.
Yes.
Okay, if you could just take one photo for everybody, I request Miss Anurupa to open her camera, and then after that I will hide you so that I can take a photo for the speakers.
All right.
Okay, ready now? Okay, 1, 2, 3, smile. Okay. Okay, so I'll go now for the speakers. I'll hide Jenny and the others. Okay, for the speakers. Okay. 1, 2, 3, smile. Another one, please. 1, 2, 3. Okay, we're done. Thank you very much.
Thank you very much. Thanks, everybody. Thank you very much.
Okay, thank you. Thank you very much, Dr. Raza and Professor Kennedy. Thank you very much. I think we had a very good press conference, and I think let's hope and start. And the website is live now, right? What is the
Yes. Everything is live now.
And we will also from CEO Club will send this message today. We already designed everything. We'll send the message immediately today.
Inshallah. Let's make it successful together. One of its kind programs, inshallah.
Yes, definitely. But thank you again.
Thank you very much. Thank you very much, Dr. Mahmood, especially to Dr. Mahmood. Thank you very much. For this
Not at all, actually. It's you and your team. Great work. Thank you so much. And let's make it a big success.
Yes. Thank you. And the first taste of success, Anurupa will give you tomorrow, because she is my star and she will give you maximum coverage.
Okay, great. Yeah, so let's hope. Yeah, just give us all the copies of all the coverage so we can put on our website, of ARISE.
Yes. Great. Thank you very much. Have a great
Thank you. You too. Yeah. Thank you. Bye.
Bye.